faith of a mustard seed. Get up on your feet, rise up.
Welcome to another segment of the Drexel SEMA Show. Of course, you know this month is Mental Health Awareness Month. Today I have two gentlemen going to address mental health. We're also going to talk about man. You know, I think this is a very important topic because a lot of times men under a lot of pressure. They're being forced to act like a man, whatever that means. And so sometimes they keep their emotions to themselves and then they end up committing suicide. And so we want to have this discussion to inspire you, especially men, to open up, to seek help, because we find that more women tend to be getting therapy, getting help than men. And with that said, I want to welcome Dr. Slattery and Tinashe, I hope I pronounced your name correctly, to the Drexel SEMA Show.
Thank you very much.
Did you pronounce your name correctly?
It's Tinashe.
Tinashe, okay. I know everybody knows Dr. Slattery, but I still like Dr. Slattery to introduce himself. Dr. Slattery is not an author, but I still want you to introduce yourself, Dr. Slattery, even though he was on the show before. But please do that then. I'll let Tinashe introduce himself too.
Okay.
Thanks, Rick. So thank you for inviting me back again. I'm Dr. Sam Slattery. I'm the lead and director of Grace Bay Medical Center. For those of you familiar with my writings and my work, I'm very, very keen to forward the idea that you have to treat a whole human being. Mental health is a significant part of being a whole human being. Your mental health and well-being influences your physical health enormously, and equally your physical health can affect your mental health. So the two are inexorably connected to each other, and this program that we've started up here, you're sitting in one of our therapy rooms, is being led by Tinashe, who you can listen to in a second, but it's really my desire and his, along with the rest of my team, to bring mental health and physical health together in a very, very practical way, and that's what we're up to in here.
Okay. Hello, my name is Tinashe Masango. I'm a mental health practitioner. I came to the island 2 years ago, specifically to open a clinic or therapy rooms rather, because I knew that Turks and Caicos didn't have much input in terms of therapies, except I suppose what was offered by the government. I was also aware that the government was trying to cover a lot of holes, but they found it quite difficult to be able to cover these holes. So there was opportunities for more private or not-for-profit organizations to come in and help out. So in the last 2 years, we managed to develop a whole clinic and a team that is probably going to come to complete fruition in the next month and a half. And it is mainly therapy-based, but we do conduct mental health assessments. We also conduct neurodevelopmental assessments for autism, ADHD. We do IQ tests for young people and adults, maybe who might be having difficulties with things like dyslexia. And yes, so far, we're doing quite well in the sense that we are very, very busy. And that is why we've got at least a team of 10 who will be working with us. So we look forward to be working with the whole population in the Turks and Caicos.
Well, that is awesome, and congratulations, Dr. Slattery, on this new addition to the industry, because we really need it. I mean, because I believe that all of us face some sort of issues in our lives, even though we may not want to admit it. And one way to treat that is through therapy. And so we're grateful that we have an alternative. And I'm so happy to see this expansion. Right? So tell us now, let's go about the man and the women. I mean, prior to discussion, Dr. Slattery mentioned, based on his research, you've seen women probably at moment, 1.2, you say, Dr. Slattery?
Yeah, it depends on which series you study, but women and men, it varies from culture and country to country, but women and men, sometimes the numbers of people attempting suicide are not so very different. It varies. Here, that's not totally the case. Actually, the more women attempt suicide here, but men tend to be successful. So a lot of women aren't successful. Men tend to be successful. When they decide to commit suicide, they usually complete it, or they very often complete it. And there's a big disparity between the number of people attempting suicide in both sexes and the fact that men actually are successful And I've always felt that's part of that is because men don't share their feelings, and they don't know where to share their feelings. Because, well, I would say they don't share their feelings, and you might ask why. And I think it's not masculine. We talked about that before the show. But more than that, they don't really know where to go, and they don't really know what to do. I mean, they don't know how to share them, and so that's sort of where I sort of started sort of getting very interested in all of this, other than sort of the mental health and physical health being tied together, which we talked about before. Yeah.
So do you think that with the men, do you think it's because of society that men are not sharing their emotions?
Absolutely, yeah. I think the way society is going is very polarized now. So we have the far left, we have the far right. We have everything is just complete extremes. And this is what's going on as well right now with feminism and what we call being masculine.
Yeah.
Is that everything seems to be going very, very extreme. So which means that what's expected of men is that you're not supposed to show emotion. Right? So it is a lot more about, women will say that, listen, I don't feel I'm heard. But over that, they're saying that if me not being heard means you speaking about how you feel, right? So which means that a man feels that he has to hold back on what he has to say or what he has to do. Now, if you want to see how that kind of manifests itself within society, you'll find that prisons mostly have men. You will find that if you go out on a Friday or Saturday night, it's mainly men who are struggling with anger. If you find that if you go on the road, people who are driving, the worst drivers will be men. Because everything is to do with aggression.
Yeah.
And this is all to do with very pent-up emotions. And whenever anybody has pent-up emotions, you find that they will express them somehow in a way that is not in the best way. And that's why men normally find themselves in that situation. Now, of course, there's far worse examples of what men do, because if you look at crimes as well, the type of crimes that men do are usually quite violent, aggressive crimes. And that is as well to do with from being at a young age that you're not allowed to express how you feel. But when we look at men who are considered to be the toughest men in the world, so the man who was known as the baddest man on the planet was Mike Tyson. Right. Now, Mike Tyson, interestingly, how he became the world champion was actually through a trainer who was more psychologically trained, who understood nurture, who taught him that you're supposed to express your emotions. So you'll find quite a lot of videos online of Mike Tyson before going to a fight. He would cry. And whereas he would actually cry. Yeah. So from a young age, he would cry, let the anxiety out, let the, whatever angers out so that he's ready and is prepared. Whereas most of us would think somebody like Mike Tyson would not cry. But even until now, with the drop of a hat, if you watch even interviews that he has at the moment, he will cry. And it's not because he's soft. We know he's not soft. Because we know him to be the baddest man on the planet, one of the greatest heavyweights ever. So he's a good example to show that, in fact, in his growth, because the more he has grown as a man, the more he has grown into a better father or a better man in society, he was able to get that platform to be able to express his emotions.
So basically, you're saying it's okay. It's okay for men to express the emotions.
We're saying it is normal for everyone to express their emotions. That's how it should be. Whether you're a man or a woman, it makes no difference. And we shouldn't be shaming men for expressing their emotions. So I think you will find it's a very difficult conversation to have with men.
Yeah.
But when they do go back and reflect upon it, they know, in particular when they go through very hard situations, they know that there are times where they feel that they need to be able to express how they're feeling, and it's very difficult. Now, I think it was important that you opened up about statistics for suicide, because locally in Turks and Caicos, the last statistics that we had for suicide, there were plenty of women who did attempt suicide. And there were about 2 men who attempted suicide. And of those women, they didn't complete the suicide. It was only those 2 men who completed suicide.
Wow, and that goes back to what Dr. Slattery was saying.
What Dr. Slattery was saying. So on a very local level, we see it. We see that women will attempt suicide, but a lot of it will be a cry for help. And they know that they will receive that help. They know that they can express it. Whereas a lot of men feel, that's it. Once something has happened, I can't express it, I can't deal with it. There's no hope. Yeah. So what we're trying to say is that there is hope. And I suppose the therapy rooms are the first place that we start giving that hope. We start to normalize these conversations.
That's good. So is it fair to say then, because men do not express their emotions, it could lead to them committing suicide. Is that a fair statement to say?
Absolutely. Yeah, it leads to extremes in behaviors. Yeah, so like we said, suicide is one extreme, and aggression is yet another extreme. I speak to obviously a lot of women older and younger within the therapy rooms. Unfortunately, a lot of the women that I do see, most of the complaints that they come to see me about involve men, as we can imagine, right? But what we don't look at is why. Why is that thing? If that's a problem, what is going on? Why do we find, a lot of the stepping out in relationships would involve a man, he's done this. Why do we find that the aggression in terms of domestic violence is mainly men who will be doing that? What's going on? So my job is not necessarily to judge anybody.
Right.
No. My job is to get to the root of the problem so that we can solve it. So we can at least, and by solving that problem over there, we might be able to solve a much bigger problem within society. Now, we're quite lucky in Turkey that we're a very small population. Mm-hmm. So it is something where if we engage in therapies as well as we can, if we can engage the community as well as we can, we might be able to see some results that are much more visible than any other place in the world. Mm-hmm. Yeah.
I mean, what do you think? I know there are probably hundreds of reasons why people have mental issues. Mm. Based on your experience, what are some of the top reasons why people are experiencing what they're experiencing, especially men?
Right. So I think we can speak locally here. Mm-hmm. So I see a lot of men for anxiety and anger. Okay. Mainly those two issues.
Okay.
And of course, that could be seen in different kind of spaces, be it at work or be it in their relationships at home. So that's what a lot of men will come and see me for. And the source of that is normally going to be in some kind of childhood trauma that they face. Now, a lot of people think childhood trauma involves being in a war or having experienced some kind of
abuse.
Very serious, physical abuse or sexual abuse, which we do have a lot of, unfortunately, on the island. Mm. But it's not necessarily that that's all the trauma that we have. So even as a boy growing up, that knowing that you cannot express how you feel, that restriction alone is trauma.
Makes you feel less.
Yeah, absolutely.
As a man, I don't know. Yeah.
Well, it just means that I don't matter.
Oh,
that's what it means. Yeah. So the message that's being sent there is that whatever you're feeling, whatever is going on with you,
keep it in.
Yes, because it doesn't matter. Nobody wants to hear. Nobody cares.
Yeah.
So when we get to an adult who believes that, a lot of the voices that we hear in our head, in particular the negative voices that we hear, are things that have been implanted in our heads from a young age.
Yeah.
It doesn't necessarily have to be an adult saying these things, but it is mostly an adult making you feel this way or making you believe this about yourself.
Yeah.
So you grow up as an adult and you feel, everybody tells you you're very smart, but when you go to work, you don't feel smart. Mm. You feel I'm not good enough. I'm not good enough to be able, and you're wondering, why don't I feel good enough? But if you go back to your childhood, most of the time you'll be able to find the source of where that voice came from that tells you that you're not good enough.
Yeah. I remember when I interviewed Dr. Slattery when he published his book, and I never forget what he said. It resonated with me because he said up to age 12, I think he said, it's like you're being programmed.
Yeah.
What the rest of your life will be like.
Absolutely.
And it's not just your whole body's programmed. Mm-hmm. 7 sort of is a big mark, but 12, I sort of use 12 and the evidence supports that, but up to 7. So it's sort of interesting what we're talking about because this raises an even more interesting topic for me, and it's something, as you know, I'm doing some work in Africa, and it's very noticeable what's going on because we've already making some changes there by the work we're doing. If you're brought up, as Tinashe says, where your emotions are not validated, like they're dismissed, you're a boy, don't cry. But it's much worse than that. So you've been taught not to you've been imprinted that you have to behave in a certain way to be a man, for starters. So you're not allowed to cry as a man. So that's imprinted inside you, because then when you do want to cry, you don't feel very good about that because that's not manly. So that's one of the imprints. The other is that child's not validated. Now my experience with the Turks and Caicos, I wasn't raised here clearly, but when I talk to patients over the years, that seemed to me, my impression is that the the way of raising a child here tends to be more towards the disciplinary type of raising rather than the supportive type of raising. So you're more likely to be sort of beaten, or it's more likely to be aggressive, sort of, stop it. If you don't stop doing that, you'll get a belt. You'll get smacked. You'll be shouted at. You'll be shamed. You'll be lots of things, and they're all negative. And that gets imprinted, as you correctly recall. That is literally wired into your brain. And that's what we're doing. That's what Tinashe's team's doing, is what I'm involved in, is we're trying to rewire those circuits. But if you can imagine what it feels like to not be heard, like you're not so I come along and say to you, look, I'm not feeling very well today. And you go, no, that's not true. You're fine. I'm like, no, actually, I'm not feeling very well today. Well, why wouldn't you be feeling very well? You don't have a temperature, it's a lovely sunny day, you just had a nice big meal, grandma's around visiting, she brought a little gift for you. No, I'm not having a nice day. Shut up. So you don't respect me, you have no interest in me, you don't listen to me, I don't have an opinion, I'm not allowed to speak. And if that carries on, this sort of negative sort of programming, goes on and on and on over years, 7, 8, 9, 10, 11, 12 years. Why would we be surprised that person turns into an adult who doesn't feel good about himself or herself and doesn't feel validated and doesn't feel that people are interested in their emotions? Wow. And for men particularly, that tends to be played a little bit harder, but I see plenty of women who are struggling as well. And so they don't feel good. So you can have this outside veneer of I'm very competent at my job, but inside, constant anxiety, I'm not good enough for my wife, I'm not good enough for my partner, I'm not good enough at work, I'm not good enough at sport, I'm not really good enough for my mates. Yeah. And then it gets transformed into behaviours that are just not helpful. Yeah. So that's what it's about. Yeah. And what we're about is not good and bad, right or wrong. What I'm interested in, Tinashe and the team are interested in, same over in medical practice, it's not whether it's right or wrong to eat a certain way, or right or wrong not to exercise, or right or wrong. It's what's helpful. Is it helpful to keep all this stuff cooped up inside? No. It's helpful to learn to let it out. And I love Tinashe's story about Mike Tyson, because it's the truth. Successful people, I'll be the first to admit, I'll do it on camera, I tear up regularly. Yeah, regularly. And interesting enough for me, I tear up about good things, like when something nice happens to somebody. But that's fine. I show my emotions. But I've learned to do it. I still guard it sometimes with the company, of course. But I think that's what's kept me sane for years, is that I've learned to do that. And and think, he's not really a man. I think that's probably not quite true. And, Wow. Does that make sense? So
Makes
what we do,
sense.
I guess the point of that long sort of diatribe, which I'm prone to do, is that how we raise children needs to change. We need to learn to nurture children, validate children. When they come to you and say, I'm unhappy, you ask them why, and the first thing you do is go, oh, I see you're unhappy. Tell me about it. And they tell you, and you go, oh, okay, all right, well, that's really rough. It doesn't matter whether you agree or not, or whether you as a parent think they shouldn't or shouldn't be unhappy. That's what they're trying to tell you. I'm unhappy. Yeah. And if you raise a child in a family where that's what happens, you end up with really healthy human beings. Yeah, that's what happens.
So okay, that's a good point you raise. I can resonate with what you say. So a parent then who has suffered from, depression, keeping things to themselves, don't you think they'll be more understanding to their child?
Well, unfortunately not. We should work that way.
Yeah.
So I think you raise an important point, which is what we call family templating.
Family what?
Templating. The template of your family.
Okay.
So this means whatever my parents were doing, I am most likely to follow that. It doesn't mean it's 100% I will follow that. Yeah. But I am most likely to follow that. A lot of people say it's a family curse. His grandfather was a drinker, his father was a drinker, and now you're a drinker, No, it's just that this is how the family learned to cope. This is how I saw my father coping, so this is how I now cope.
And this is not to butt in, but that's the imprinting we're talking about.
Yes.
From the age of 1 to 12.
Yes.
That's what you see, that's what you experience, that is what's wired into your brain.
So that's also something important. I mean, I see a lot of people for relationships. I don't just see people who have problems in relationships. I see people who are getting into relationships and they're thinking, we need to make sure this works fine, which is absolutely amazing, which is forward thinking. I need to know, who am I getting into this relationship with?
That's important.
What are their values? Do they understand where we're trying to go to? And another important thing that you really need to know, which is something we lost over the years, is that everybody used to know so-and-so's family. They would know, oh, that's so-and-so's family, they're from there, this is what they do. The importance of knowing that was for family templating, in the sense that they would warn the daughter, warn the son, you do know that his father was a bit like this, so what has he done to resolve that, to make sure he doesn't do that? Yeah, because we're all very prone to following the same template that we've seen in our families. And unfortunately with a lot of us African and Caribbean people, with our background of colonialism and slavery, there's a lot of bad templating because families were broken, and then we still then follow those same kind of broken family templating. I think you raised an important point about hitting children. So we never think about, why is it mainly in the Afro-Caribbean community that we actually say, yeah, it's okay, you should, and we openly say things like that. It's okay, we should hit our children. We don't look back at a time when, yes, it was okay to watch another person getting hit, and we accepted that that's normal. That's how you control behaviors. And then we've taken that on. It's something that we think is normalized, when really it came from a very bad place. Yeah. In fact, what we know scientifically now is that if you hit a child, in particular in the head, but generally if you hit a child, that means that they cognitive they become cognitively impaired. So which means that their IQ could even drop. They might not be as smart. So you think you're hitting them to be smarter at school? In fact, you're making them a lot worse just by being able to do it.
Yeah, and I think you create a lot of fear too.
You create fear. Yes, exactly. How do you say I love you and I hit you at the same time? And then we get surprised when our daughters get into relationships with very abusive men, or our sons become abusive men. I love her, but I hit her, or she accepts that, okay, he hits me, but I do love her, because the template has normalized hitting as a way of love.
Yeah, and I meet people who've actually expressed to me that if they're not hit, they don't think they're being loved.
Yeah.
Which is, when you think about it, that's crazy.
Yeah, it is.
I mean,
but it happens. But it is.
Oh no, it's common.
Yeah.
I wouldn't say this happens. I think it's relatively common. Like, if there's not some aggressive masculinity in the relationship, there's something wrong with my man. And if I'm not a man that's masculine and aggressive, there's something wrong with me. So that's where we've normalized it. But if you look at traditional societies around the world, that is not what happens. Yeah. And Tinashe is right. This is one of the great scars, cultural scars of colonialism, because that's how the colonial masters managed people, was through violence, intimidation, and fear. Yeah. Then they also, it's interesting, we were discussing this before, about how Africa is very noticeable. But it's noticeable anyway.
Africa is colonial.
It's very noticeable.
Oh, okay.
Because what happened was the colonial powers that were in Africa destroyed the traditional fabrics of society, and the damage that they did is still being felt to this day, and badly so. It's one of the reasons that I believe it's one of the reasons why certainly I'm in Malawi, but I don't think it's very different in countries around. When I talk to people, is why they struggle, and they do struggle. And part of this is this male sort of aggressive, dominating behavior, which is not actually natural. It's one thing to be powerful and be a strong leader of the family and be there for your family, to be a Mike Tyson. Like, if you're going to take out my family, I'm a big enough guy that I'm going to stand up and defend them. But that's not the same as I'm going to go out and start beating on my family. Because that's how I control them. That's completely not how it's supposed to work. But that is how it's happening. So this leaves, now, as Tinashe says, now we imprint the child, we're templated by the family history, and off we go again. So one of the big things about what we're trying to do in here, and we all feel very strong about, is to break this cycle. And it's actually what I'm doing in Africa. I'm doing exactly the same work in Africa, but I'm doing it one step down through schools. We're removing violence from schooling in Malawi. That's through this one little project we're running, and it's already working. It's remarkable to see what's going on.
That's very remarkable.
And just to kind of say about change. So I do meet a lot of amazing Turks-sided as young men, undecided. I mean, young men who are in relationships, doing absolutely well in these relationships. Unfortunately, they do get kind of painted with the wrong brush.
Yes.
So, and that's how it is. So we don't really, like I said, in this job, we don't do judging.
Yeah.
The reason why people would look down on such young men is because they don't understand. They've never really looked at why they see the world the way they see it.
Yeah.
So if you've never seen the world in any other way, the way you see it is the way that's right.
Yeah.
Yeah. So a huge part of what we do here is we validate a lot of these young men who do come and see us and say, listen, is this okay? Because this is just how I feel and this is how I think is okay. And say, listen, there's nothing wrong. This is exactly how it should be. In fact, those are the game changers.
Yeah.
Yeah, these are the young men that we look forward to, who are, you know, by the way they're functioning, by the way they're living, because that's how it sees. How does it manifest on a day-to-day?
Yeah.
And if you're noticing that on a day-to-day, your relationships are not working, be it your relationships at work, your relationship with your partner, none of that is going on, then you should know that something might be wrong with me as well. Yeah. Why do I keep getting in these relationships? Why do I keep finding myself in these same situations? Yes, there might be a part that you're playing in this that you're not aware of,
Yeah.
that you need to deal with before you can get into your next relationship, and hopefully your next relationship might be different. Yeah.
Absolutely.
I'm tougher than Tinashe on this. I think the first person when you're in a difficult relationship with you should look to is yourself.
Absolutely, yeah.
Yeah. And
Absolutely.
it's not what we do, is it, naturally. So when you listen to people talk about divorce or breakup, they always talk about what their partner did.
Yeah, they blame the other
She
person.
was, he was. You know, they didn't. If only they had. If only she had been. If only he had been. It was like, hang on a second.
What about you?
How about what did you bring to this table?
Very true.
And again, some of the, people say, well, people know I'm separated. Well, what's that about? And I go, well, because it took me a long time to figure that out. So I'm no different from anybody else. And part of why we're doing this is to share information with other people from our own journeys through life, And I'd be a classic example, It was always about everybody, It wasn't always about talking about everybody else. I'm being stating it. But for sure, I wasn't so good at looking at myself. What role do I play in all of this?
Yeah.
Yeah, so I think that's a really important message to try and push out
Very.
people.
Yeah.
If you're struggling in a relationship, whatever, family, children, partner, boss, one of the questions is, what am I bringing to this relationship that might be contributing to this problem?
Yeah.
And if you're not sure, then you can come in here or come and find somebody who will go, well, and help you unpack some of that stuff in a safe environment where you're never going to be judged.
Right.
Nobody's going to look at you and
Everything's
go,
going to be confidential.
that's total. Well, more than that, never mind the confidentiality, I would say, it's more than that. It's more that it's a given that it's confidential. But it's more, I'm going to listen to you and hear you out. And 9 times out of 10, probably closer to 10 times out of 10, what you're actually going to find is that people in here are going to go, well, given the way you were raised, and given your life experience, which is exactly what Tinashe was saying, why would you be surprised that you behave like this?
Yeah.
So that's how we'd expect you to behave. But it's not really very helpful, is it? Because it's not really helping you in your relationship with all these people. So maybe what we should explore is there a more helpful way of having interpersonal
Yes.
discussions. And so now it's about you as much as them.
Yeah.
And doesn't mean that they don't have their own problems, because they do.
Of course.
But you can't fix them. You can only fix you. So you come and get help, and we'll help you if you want. Learn some tricks and skills and understand why it is you the way you are, and then hopefully become a more helpful person in your relationship.
Yeah.
So
It's important.
Yeah.
I mean, I know you talk about breaking the cycle. So I know you have this facility here where people can come in. Of course, some people are not going to come because they're afraid and they don't want to, I guess. But what do you think we need to do to change that culture? Where we could break that cycle to encourage people. I mean, what can we do more? I mean, of course, the show will help you, but what else can we do?
I'll be honest, Rex, I think there's been a lot of work that's been done over the last year and a half.
Okay.
I don't know if you've been noticing the government initiative at the moment about breaking stigma.
Yes, I have.
I actually went to the Shore Club last week where they held absolutely amazing talk where some prominent members of the community were speaking up
Yes,
about
I saw that.
struggles. Yeah. So the truth is, we're already there.
Okay.
Yeah, we are already there. We are very busy here. And a lot of people are discussing therapy because it's now become normal. Before all of this, my job would have been an uncle who's got a lot of life experience. And someone would know that, listen, I'm going through some difficulty. They would then come to the uncle and say, Uncle, this is what's going on. I'm struggling with this and that. And the uncle is able to direct them to the right way about how to deal with things. Or uncle goes to speak with the parents. I don't like how you're dealing with him. You know, if you keep doing this with him, this is going to be the outcome. We don't really have that anymore. We don't. So this is where psychology became a really huge thing, and it became essential. It became somewhere where we look at human behavior. What is going on? Why are people doing this? And in particular, right now in Turks, with everything that happened last year, you know, through to this year with our young men over on the island, where everyone was asking, so what do we do? What do we do? What's going on with these young men? There you go. This is exactly what we need to be doing. We need to be allowing these young men to be expressing themselves from a very young age, so we know what's going on. So they know that they don't have to go to the extremes of violence. We need to be treating them better. We need to give them nurture. We don't have to be hard on the young man, and then we need to be soft on the daughter. And that's very normal. In particular for men, you know, we're the worst at that.
Yeah.
If we have a daughter and we have a son, the girl is more, we'll hug her. The boy is more, okay, listen, you need to stop that.
Yeah, that's true.
So we need to start normalizing, saying, no, that's not how that works. What messages are we sending to them in terms of being able to regulate their emotions? And what does that then mean for a society? So I think as far as Turks is, I was very surprised about how well people engaged in therapy. And I'm talking about all walks of life.
Really?
Yeah, so I mean everybody in Turks in the Turks and Caicos Islands. It doesn't matter whether you're an expat. It doesn't matter whether you're a belonger. It doesn't matter literally everybody does show up. I think in the beginning people might used to creep in because I suppose the assumption for a lot of people is that we see a lot of people who have very severe mental health illness, right? Which is something that we don't do here. Yes, so we actually are just a therapy room. Therapy rooms just for therapists and talking therapies. Yeah, we might at some point, I suppose, get to the space where we are, you know, we have the right facilities.
Severe cases.
That's right, exactly for severe cases. But at the moment, we don't have the facilities for that. So, but as far as that's concerned, people are talking out there. People have normalized it already, and as such, we are just ridiculously busy.
Yeah. I mean that's good because, I mean, hopefully we will see a change in our society. As more people start talking and understanding and appreciating who they are, rather than keeping things to themselves, because sometimes they act out through anger and through other emotions.
Absolutely.
So hopefully with this facility that you have, what do you call it? What's the name of your?
So this is the Grace Bay Wellbeing Center.
Wellbeing Center. Through the Wellbeing Center, hopefully we could change the society into a better, productive society.
Absolutely.
You know?
Totally. And it's about, I'm going to just carry on with what Tinashe says. It's been very interesting to watch what's happened over since he's been here. People did used to literally creep in and, and then they'd be embarrassed to tell the staff at the front desk. Now we're actually a separate unit up here, so it's fine with their own reception, but it doesn't matter. Now people greet each other as they're coming and going. It's completely different atmosphere.
They feel good about themselves now.
Yeah, because they come and they get help and they realize. And so what we're, in a sense, what we're normalizing, because there's nothing abnormal about this. How could it be abnormal if 80 to 90% of men tend to be aggressive? That defines normality. It doesn't mean that it's helpful normality, but that's the norm within our society. It's not how it should be, but it has become the norm. And it's not the norm just this generation. It goes back several generations for all the reasons we talked about before. So part of it is just opening up people to, it's partly why I wrote the book, and a big part of the book's about mental health in a sense. And it's like, well, okay, it's normal. Like, you don't sneak in and out of the Grace Bay Medical downstairs because you've got high blood pressure.
No, no.
But in a sense, you probably should at one level, because it means you're not looking after yourself.
Yeah.
All right.
Yeah.
But why is it that people were used to, increasingly less so, think that they should sneak in and out because they're angry or they're sad that they're,
I think it's because it's like them.
And
it's because of society. It's because
And we're all the same because we
Yeah.
all have these feelings. You have the feelings, he has the feelings, I have the feelings. They're not white man feelings or yellow man feelings or black man feelings. We're all human
it's not
beings. And we
restricted to
had
one
this
race.
conversation before,
Yeah.
at the end of our last chat. You know, it's nothing to do with race or colour or background or religious belief or sexuality or any of these things. Humans are humans.
Yeah.
We have a basic set of wires that are put in us when we're conceived and then we develop in the womb, and they need to operate normally. And society has changed so much from the way we evolved over the last several thousand, 60,000 years, all right, that we're always at odds with our biology, and our mental programming is always at odds with the societies that we now live in, which in itself creates this sort of strange imbalance. And in fact, we've just all been doing it. We're bringing in something called DBT, which is dialectical behavioural therapy here. And the dialectic is about exactly that. It's like, how do you have two completely opposite things occurring at the same time and existing in the same place? But they do.
Yeah.
So we've got biology, and we've got traditional programming, the way a child should be programmed, raised in a village. We've talked about this before, with lots of different people, support, love, caring. Yeah, there are tough moments. We're supposed to fall over and graze our knee, and we're supposed to sort of, if you're cheeky, you might get a little clip on the. But it's a like, that's not appropriate, but it's not violent. It's like, maybe that's not quite the right thing to do. You can be told off. Of course, you should be told off. All right, you can't. You have to show respect for other people. And if you're a child in the playground and somebody bites you, we don't let anybody bite you back. And I'm going to say something really controversial again. In kindergarten, the kid should bite you back. You bite one kid, the kid bites you back. You know what you learn? That's probably not a good idea. That hurt. But that's a different learning experience from somebody coming up and smacking you because you bit the kid. That's completely perhaps the wrong message.
True.
So the teacher walks over and you bit the kid, you get big punishment, you get smacked. You know what, let the other kid bite the kid back. That will be the last time they bite each other. So that's what I would call normal growing up.
Interesting.
All right?
It's the balance, absolutely.
It's a balance growing up where I learn, I try something.
Boundaries
and
and nurture.
Boundaries and all the rest of it. And it was done in a community with lots of different people, aunts, uncles, different characters. We were all done in the village. And in a sense, we came out rounded. But it was supportive.
Yeah.
Yeah. Now we don't live in that sort of world at all. And it's completely at odds with our biology and our evolutionary wiring. And then we wonder why everybody's struggling.
I know. You're right.
You did.
So I know, very good point, Dr. Slattery. So I know the different nature of people's conditions. But based on your experience, how long does this process take talking with you and coming out feeling good about yourself and knowing that you could express how you feel? Is it a lengthy process?
It really depends what someone's come for. Yeah.
Right.
Some people literally show up here because they have no one else to speak to. Yeah. I have no one else to talk to about this. So I might see them once and that might be it. Right?
Okay.
I think you mentioned something important about confidentiality. One of the main questions that I get asked when people call is, are you from here? Are you from the Turks and Caicos Islands?
Really?
Yeah. In fact, that used to be a very common question because I've been here now 2 years.
Right.
So I'm pretty much, I live here now.
Yeah.
But before then, that was the question. One thing people have to know is that we are answerable in this job, right? And our job is very flimsy because the moment something slips out of this office here, that's my license gone. So that's my career gone, everything I've worked hard to do is completely gone. So whenever somebody invests into doing this job here, we have to take it seriously. So I've been doing this for 20 plus years. Yeah. So it is something that we learn that's a standard.
Yeah, and in fact, it should be a standard in all of our jobs.
It should be absolutely.
Everything we do,
yes,
that should be a standard.
It should be a standard.
Not because you are a licensed therapist. I mean, all of us need to practice that.
Absolutely, absolutely. Yeah. So what I'm hoping that happens is, I know we live on a small island, and I do know that people do talk. Yeah, that's not unusual.
No, people talk everywhere, but it's more prevalent here. The school.
Things travel through the grapevine.
Yeah,
that's how things kind of tend to happen. But that's a culture. That's a culture that probably wasn't always there. It's a culture that we built. What we're hoping to do by seeing a lot of people here by people knowing that whatever we talk about, it was great that we kept it in here and we actually dealt with it and it was okay. It's people who leave here are different friends to the people that they're friends with, or they're different fathers or different mothers to their children, because they too then become very confidential in what they're dealing with people. So it becomes a culture change. So that's why I said we are social scientists. The ultimate goal is not just to help somebody here. The ultimate goal is to make sure that we change certain cultures that don't need to be there, or certain templates that have been kind of put there that don't need to be there. And just to kind of answer the question, there's no real length of time. Yeah, it is not up to me. It is actually up to whoever I'm seeing. When they feel, listen, I've got everything I need, because everybody shows up here and we write down some goals together. Okay, so this is what work we are hoping to do, and this is what you're hoping to achieve. Sometimes people will say, listen, I've achieved this goal, and I also want to be able to do this. I've noticed this. What do you think? Should we just go ahead and do that work? And we go ahead and do that work as well.
Okay. I know you mentioned that you don't cater to severe mental. What is considered? Because people wanting to watching the show and wanting to come and talk to you.
Yes.
What is the difference between the regular talking to you about the issues versus the severe?
All right. Okay. So we're talking about disorders at this point in time.
Okay.
So when something is now labeled a disorder, it's something that completely changes the functioning of your life. So maybe somebody would have something like schizophrenia.
Okay.
Which means that they can barely hold a conversation, because while they're holding a conversation, they're hearing other people talking within their head, and then that becomes very difficult. So at that point, we're not very medically.
That's an example of severe.
So that's an example of severe mental illness.
Got it.
And what you need, it's not that we're not able to do it as clinicians. We are able to do that. So that's my background. But certainly it's about having the right facilities to be able to do that. So we just want to get this right. So what we said is, let's start with what we know we can facilitate. What can we do and what can make the biggest change at the moment? And we said, listen, we know there's a lot of stress on this island. We're talking about a paradox.
Yeah.
We live on a paradise island, but it can be a very lonely place.
Yes.
It can be a very difficult place.
Stressful.
It can be very, very stressful. And just that paradox alone is very difficult for a lot of people to deal with, because sometimes when you see now what everybody else is doing and you're looking at yourself, you can make certain judgments about yourself.
Yeah.
I think it's been a little bit sad over the last year, because I have noticed that there's a lot of young people leaving the island. A lot of Turks Islanders leaving the island. And that's because of things like that. Yeah. It's feeling, am I good enough? And I think I would advise to say, before you pick up and you go anywhere, sit down. You don't have to come and see us. At least see some therapists. Yeah. Sit down and really talk about why. Why am I feeling this way? Is there another way I might be able to see this?
Yeah. And it's all because of society. The good news is a lot are also returning as well.
Fantastic.
Yeah. But it's society really dictates our behavior, unfortunately.
Oh yes, absolutely.
We're living our lives to please people.
Yes. Yes.
Well, we do, don't we? Because we want to be. Because it comes back to what we're talking about at the beginning. What you want is to be validated. You want me to look at you and go, "You're a complete person, and I like you." And I feel the same way. I like it when people look at me and say, you're a nice person, and so we feel validated. But so if you live in a society that doesn't validate you, or a family that doesn't validate you, or you're in a workplace that doesn't validate you, we talk a lot about. Validation is key to having a good relationship with anybody. Like, anytime you express something, you want me to at least start off by validating that that's what you're trying to explain to me. My worth is connected to that, because if I dismiss what you tell me, if I say, oh no, you're not really tired, I think it's just because, or I don't think you're as sad as you think you are, but I think you're just overstating it. I think you're overly jealous. Right? What I'm really telling you is actually your opinion doesn't really matter to me. That's the subtle and perhaps not so subtle message. So now, do you feel validated? Do you feel like I actually appreciate you, or think you're a solid person? No, you don't feel that way. And this is exactly what we do to each other all day long. We do it in the media.
Yes.
Government does it.
Schools do it to their pupils.
Teachers do it to the children.
Partners
to
do
the
it to
students.
each other. You know, honey, I'm really feeling down today. No, you're not. You think how often you hear people say to other people, no, I don't think so.
Yeah.
No, I don't think so. Well, actually, I am feeling that way right now.
Yeah.
Well, you're just being overly emotional.
Yeah.
Now, why don't you just let me go, I'm feeling sad, or I'm feeling angry, or I'm, you know, and then suddenly you have a conversation. So that's everywhere.
Yeah.
That people in this town, no, it's not just the Tism.
No, I
but
mean,
they're not validated.
Yeah.
And I'll tell you, it's like, and I'll get controversial a little bit here. It's like immigration. I come here, I move, I give something to this country, I have roots, but I'm treated badly. And you are treated badly, all right? Go through all these processes of paperwork and all the rest of it. Rather than people in this society going, maybe you have something to contribute to our society.
Yeah.
And maybe it should be something different, like welcome. And even go a little bit further, like thank you.
It's a good
Thank you
example.
for bringing your skills or whatever it is to you. Now I feel validated. Now my stress levels go down.
Yeah.
Now I'm more likely to give more to the community. And we do this, and that's just one example.
Yeah.
And I'm not taking out immigration. I mean, we do it
that's
all over the place.
No, that's a good example actually.
It's a big thing, and it's a cause of an immense amount of stress. But there are lots of other stresses, all the other things. So I mean, if I find one message I would put out to everybody, you know, when somebody speaks to you, listen to them. Number one, and then in a sense, speak back to them what they just told you, and validate their feelings. It doesn't matter whether you agree. It doesn't matter if you can't understand why they feel that way. It doesn't make any sense to you at all. It is how they're feeling. And when they express it to you, then it sort of makes sense that you might show them some respect and go, I hear you.
Yeah.
Do you want to talk about it?
Yeah.
And in a sense, that's a lot of what we do in here, isn't it?
Absolutely. That's a huge part in terms of validation. I think it's important that we understand that we're not trying to turn boys into crybabies. Because people can start to focus on that.
I know.
What is Tinashe and Sam trying to say? That, you know, we want all our boys to just cry. No, what we're saying is this. We're saying that we do have problems with our young men. And we need to be looking at the source of those problems.
Yeah.
Because we see how it manifests.
Yeah.
Last year was hell. Relationships are very difficult on this island. You know, even if we don't talk about relationships, I think last year there were there was a lot of sexual violence that was happening. Things that are completely out of the norm. There's nothing normal about any of these things.
No.
And we're saying that there's young men that are involved in that. And we need to be taught. And I know that there's a lot of men who don't agree with any of these things. But we need to be talking about how do we solve these things?
Yeah.
How do we make sure that we don't have any chances of our young men falling into these traps? Yeah. And it starts very early. It starts by being able to validate how they feel, being nurturing to them, allowing them to be able to express themselves. So you don't have to agree with them. But certainly if they say, listen, I'm feeling upset by such and such, you have a right to feel upset.
Yeah. You don't know how they feel, so accept what they say. How they're feeling.
Yeah.
And then listen and
this is it. And if we don't change anything, I think I love Turks and Caicos because it's a praying nation.
Yeah.
But if you pray and there's no action, nothing's gonna happen.
Well, the Bible says fear without works is dead.
Absolutely. So we need to be doing, the action. We need to be changing, and this is at a very individual level.
Yeah.
What part am I playing to change this? What am I doing with my son? What am I doing with myself to make sure that we change the way things are at this moment?
Yeah. Wow, this has been such a wonderful, informative. I feel like it can continue forever, but we have to end, and I would like for you to wrap up with some closing remarks.
Lovely. I'd just like to say to Turks and Caicos, I've been welcomed to this country, and it's been an amazing 2 years to get to where we are right now, building this wellness center. We actually look forward to seeing a lot more people. We are going to be pushing to make this a non-profit organization so that access is for literally everybody.
Okay.
So please just kind of keep your ears open with regards to that. At the moment, just be aware that for most of your kind of therapy needs, now we will be able to provide that for you. A lot of people have complained that time has been an issue for us because we've been overwhelmed. But now we've got a lot more therapists that are coming in, so you don't have to worry about that anymore. And also, like I said, we've got the side where we've got assessments for autism, and ADHD. Yeah. So please be aware of that. That you can be referred by a GP, or you can actually present to us, and we'll be able to do your assessments, and not just assessments, but assessments and follow-up therapy, which is something that wasn't happening on Ireland.
Yeah, thank you. Well, thanks first for doing this again. I'll just add to that pretty much the message the drum I've been beating for a few years now is that your mental health is really, really important. It's an enormous part in your physical health. So being mentally healthy matters. In terms of what we're offering in here, we often focus on younger people in the sense when we talk about what we're doing, but cognitive testing for older people, some people worry that family members or even including themselves as we get into my sort of generation, am I losing my cognitive skills? We'll be able to check and talk to you about that. Do you show signs of early dementia? Are you showing signs that you can't do your job? So that's one thing. That's just the pure clinical psychology side, just the testing things that we can offer. But I think the most important message I really hope that came out of today is that hopefully we're striving, and we do, not hopefully, we do provide a private confidential space for you to come and talk about the things that are bothering you. And our feeling is that once we start to do that here in the privacy of these treatment rooms and therapy rooms, that will essentially sort of wash out into the community and start to change the way that people interact with each other as they see certain people becoming more successful, and people are like, well, what happened to him? Why does he seem to be more relaxed or a little bit more successful, or his wife seems happier, or whatever it is. And the answer is because we've given him or her some skill sets to manage some of these rougher parts of life that we all have. And I think the last thing is what I always say. I don't care where you come from. I don't care what your religion is. I don't care what your colour is. I don't care about any of those things. You're a human being. The biology inside us is all the same. There's a tiny veneer of culture. But basically, we all want the same thing. We want to be heard. We want to be loved. We want to be appreciated. We want to have some sense of worth in our community. That we got up this morning and that we're somebody that contributes something to a community in which we live. So,
thank you. And before I give my remarks, do you also do marriage counseling?
We do, yes, yeah. So we do all sorts of therapy and counseling.
Okay.
So be it individual therapy or marriage counseling, everything.
Okay. Yeah. Okay. So I know that a lot of someone texts me one day and say like, oh, to get, they say, oh, go to your boss. They say, but he's not married. He might not be able to help me. So,
some therapists might not be married, but they're trained to do so.
Okay.
But certainly, we do provide that.
Okay. Well, thank you, Dr. Slattery and Tinashe, for being on this show. I really enjoyed the show. For those who are watching, I encourage you to talk to somebody. Don't be like me. I kept everything to myself almost 48 years. And I wish I had known what I know now. I could have talked to somebody. I probably would have been further ahead in life. But anyway, I cannot look back at the past. For those who are watching, it's important for you to stop keeping things to yourself. It's only going to hurt you. If you want to be bad in life, then you need to talk to someone. Stop being pressured by society. I know there are a lot of men out there who don't want to show their true emotions. Listen here. We all are human beings, as Dr. Slattery said. And man and woman, there's something about us that we have the same sort of characteristics. And one of those characteristics is that we must express our emotions. So don't keep your emotions to yourself. When you keep your emotions to yourself, it can cause so much damage to yourself, so much damage to your family, so much damage to society. It may even lead to, suicide. Is that what you want? Then talk to someone. Grace Bay Wellness is here. They're located right in the Grace Bay area. Exactly.
Just above the seafood hub.
Above the seafood hub. Of course, I should know I'm right here. Please check them out. It's important for us to change our society. Our society can change through us individually, and we must change. We have been embedded in this culture of sticking to ourselves, not expressing how we feel. We need to change that. I tell you, we change that, I believe there'd be less crimes. I believe there'd be less divorces. I believe that relationships will be improved, society will be improved. That's what I believe. And I think it is true. With that said, thank you for watching the Drexel SEMA Show. Please remember to subscribe.